1 out of 10 people in the population have a scoliosis.
Hi guys, it's Aimee, your golf coach. Welcome to Seniors Must Do series. Dr. Clements has really fixed my back. We're gonna learn in depth about your joint health to help you enjoy this beautiful game of golf as long as you choose to instead of your body chooses to. What I remember when I came in to see you is that you gave me treatments and then you told me what to do to get better, and I did everything you told me to do, like working out, stretching and all that, and I was really amazed how fast my back got better. The first time I came in to see you, I couldn't play more than 7 holes, and then soon enough I was able to play 18.
If you're gonna golf and you really wanna golf a lot, you're gonna need a chiropractor. In school, they actually focused most on one sport when they were teaching us chiropractic, and they focus on golf. Because golf is one of the hardest sports on your back.
I actually have 2 questions that I got from my viewers recently.
Okay.
I wanted to ask you about.
Sure.
First is scoliosis. I have quite a few golfers who have that condition. So, I mean, I'm not too familiar with that. Could you talk about scoliosis a little bit and how it can affect your golf swing and what you can do to, I don't know, ease the pain?
Sure. Scoliosis is, we're the experts. We actually know the most about the scoliosis than any other doctor.
The right person to ask.
And so 1 out of 10 people in the population have a scoliosis.
Is it like genetics, or is it something you can do?
It's in
to
your
cause?
genetics. You were born with it. You can't change it. It is you. And so some of the scoliosis, we see that that's their normal.
Oh.
That they're normally that shape. If they cloned them, they would be that shape again. So it's not something they did, it's who they are.
Oh.
And so we don't try to change it.
Okay.
Somebody with a scoliosis, they have new rules.
Okay.
That do not apply to somebody with a straight spine. So with a scoliosis, your body leans to one side more than the other. So one
Depends on where the curve is.
carrying more weight.
So it would actually change how you turn in a golf swing too.
Your flexibility is different in a scoliosis spine because of that overloading one side and the wear and tear that side endures. And it causes a lot of compensation issues in the back. And so somebody with a scoliosis has to be seen by a chiropractor. We say once you have a scoliosis, you're a chiropractic patient for life.
Okay.
Because a scoliosis, arthritis develops quicker in that spine than one that's straight. So we want to keep it healthy so that arthritis doesn't take over and cripple you. And so what we teach is specific stretching for that specific scoliosis, and they're all different. So you can't just say, you have a scoliosis, do this, and it'll work.
Is it because they have all different shapes?
All different shapes.
So it puts pressure in different parts of the body because
There's
of the
no
shape?
2 scoliosis alike. And they're all different, and they all need to be managed differently.
As a teacher, I really should know about that stuff to help them get their swing going correctly.
Understanding they need knowledge on how their back should be treated and how it should be exercised, because it has its own blueprint of how it would like to be treated.
So they should still do the same thing as everyone else should do, like stretching, warming up, exercising to maintain the condition, but in their own way.
So those are all critical, but they will have different stretches that are more important for them.
Yeah.
So they will be doing stretches that I'm like, why are you doing that stretch? I'm like, because that's what's important for them. A lot of times it's unilateral stretching, where they'll only stretch one way, never the other. And so then that causes a balance, because their body's always leaning to one side. It gets tight. So why stretch the loose side more when you should only be stretching the tight side? And a scoliosis is something left untreated, it will start to become a problem earlier in life. But I have patients in their 90s with a scoliosis that's severe their entire life, and they're still enjoying sports.
Really? Wow.
So it doesn't mean that you can't enjoy it. You just have to learn about what your spine is all about.
Maintain it well. Okay, second question. Thank you so much. Do you have anything for those of us who have frozen shoulders due to multiple shoulder surgery, severely limiting our range of motion, as well as neck fusion surgery? The pain in the shoulder causes lack of sleep sometimes. The days I'm feeling better, I can hit straight up to 280 yards. Other days, I'm playing Army golf, hitting left, right, left, right.
Okay, well, there's a lot of questions there.
Yes.
Mentions frozen shoulder, also mentioned surgeries of the shoulder, limitations of motion in the neck, and then also surgery in the neck. So I have a feeling that this person who is asking this question is suffering from scar tissue.
Oh.
That their injuries have created scar tissue that now scar tissue as it ages gets tighter and tighter and tighter. And that's why your range of motion is getting less and less and less.
About that,
when you
can I
cut your
close it?
skin, for example, you will notice that it bleeds. You put stitches in it and the body heals. Well, how
Yes.
does it heal the skin? It doesn't return to natural skin. And we have a process of healing that's now scar tissue forms. Scar tissue is not as good as the normal tissue. It's like a glue that just sits there to weld the skin together. Well, let's go inside a joint, like the neck or the shoulder. Now we see that there's been some catastrophic failure, and now there's a surgery fusion in the neck, which is excessive. The surgeon goes in there and repairs the joint. Well, he has to go in there with a knife, cut you open, patch things back together, sew you back up. What does the body do? Well, it pours Elmer's glue all over the area, and it hardens. That's scar tissue.
So even like inside your body, your scar tissues will harden up like it does on the outside.
Correct.
So that can really limit your range of motion.
And so now scar tissue becomes a big problem in the after recovery. And if scar tissue is not addressed properly, that's where you're going to have some days scar tissue does not like cold. It really needs to be warmed up. It has no blood flow to it.
Oh.
And so blood can't enter scar tissue to warm it up like it can the muscles, the tendons, and the ligaments. So scar tissue just has to get warm because your body is getting warm.
Because of the heat around it.
Correct. So on warm days, you'll notice, I'm hitting the ball great because your scar tissue is stretchy. You go to play at 5 in the morning when it's cold, your scar tissue is very stiff and tight, and now you're trying to force that and you cause other problems.
Is there anything you can do about the scar tissues?
Well, there are different forms of massage. There's different ways we can use lasers. There's different ways to manage scar tissue. And even just doing repetitive stretching to make that scar tissue more pliable. Kind of like pizza dough that's hard, you gotta work it. And as you work it, all of a sudden you can now make it into a pizza. Well, the scar tissue can be stretched and pulled and torqued and worked so that it becomes a little more pliable so that your range of motion increases.
Oh, that's awesome. Awesome. Wow, that was great. And you offer different services here too, like massages and acupuncture?
We have acupuncture also, and chiropractic. This is kind of one-stop shop for alternative medicine.
Yeah, I used to always come in, get the massage first, and then see you. You know, I just remembered how much in pain I used to be back in the day when I first started working with you. Pretty thankful.
It's been a journey.
Thank you. He's really awesome. You're really awesome.
Well, thank you for listening.
Yeah, so, you know, this is all really great information on the body in relation to the golf swing. I hope this was very helpful. I will do a couple episodes followed by this to give you golf tips according to sort of what he's mentioned. And I really love how you emphasize the stretching, the warming up, and the exercising, because those are really important.
So this happens to be a talk that has interested you, that maybe you need to seek help for your pain and injuries, and you want to come seek professional help. We can definitely sit down and talk and come up with a solution for your problem so that we can help your game.
I drive an hour to get here, so guys.
Today's interview was absolutely amazing. It was super valuable for me. I hope you guys felt the same way. There are a lot of new information he gave us, and also, you know, some of the things I emphasized in my golf lessons, he just kind of gave me confirmation. That was really wonderful, especially coming from a medical point of view. And please look forward to the Seniors Must Do series. We're going to be doing more interviews and more golf tips for those of you with physical limitations and injuries and whatnot. So thank you so much for joining us today. See you in the next one. Mwah.